Let's turn to the big focus story at this hour. We are looking at the figures that has just been released on India's total health expenditure that has dropped to 3.2% of the GDP in 2018-2019 from 4% in 2013-2014, according to estimates of the National Health Accounts 2018-2019 that the government released on Monday. Although out-of-pocket expenditure on health, which pushes lakhs of people below poverty line each year, declined by 16 percentage points from 64.2% to 48.2% in the same period, this is very little assurance, given in the larger picture the number has declined. There was also an increase in the social security expenditure on health, including government-financed health insurance and reimbursement to employees from 6 to 9.6% of the total health expenditure. But beyond those two parameters and those two markers, the rest of the figures that we are looking at are dismal, especially when we compare them to the global figures. So India records a poor showing, and what we will do is we'll put out those graphics for our viewers to take a look at what we mean when we say India has posted a poor showing compared to global figures. My colleague Pooja will take us through the figures. Pooja, we've put together data that has just been released, but we've also compared it to give our viewers a perspective on why these are dismal figures. The world average of general government health spending percentage of GDP compared to India's figures. Over to you, Pooja, for what we have on this.
That's absolutely right, Afrida, like you put it out. In fact, it's very concerning, keeping in mind how there has been utmost debate and discourse even after the second grisly wave of COVID-19, and it's concerning why the government spending on health is going down in particular here. And here I would like to draw the comparison of India's spending on healthcare as compared to the world average, and this we're talking in terms of the percentage of the GDP. Now, while the world average stands at 5.89% right now, India's average in terms of the percentage of GDP, the spending on healthcare stands at 1.28%. Not just that, in fact, if we also talk about the health expenditure per capita, the world average stands at rupees 89,000, while India's expenditure in terms of per capita stands at 4,470. So the important question that needs to be asked here is that why is the government not spending enough in terms of healthcare at a time, when we've seen when COVID has also exposed the crumbling health infrastructure of the country? What needs to be asked is if there is enough communication and coordination between the states and the center when it comes to the spending on healthcare.
So the issue of per person expenditure, is there a quick overview you can give us on that, Pooja?
Could you repeat that question, please?
Yeah, on the issue of the per person health expenditure, we can put out the graphics, and if you can just talk us through the graphic if we have it, please.
Yes, absolutely. So speaking about the world average of the general government spending as of percentage of the GDP is currently at 5.89%,
yes,
while the world average of the total healthcare spending is at 9.83%, while India stands at 3.2%. And here, if we talk about the world average of the out-of-the-pocket expenditure, which is at 18% of the total expenditure, whereas India here stands at 48.2%. And lastly, if we talk about the world's average health expenditure per capita, which is approx 89,000 rupees, if we compare India's expenditure in terms of the world average health expenditure, it stands at rupees 4,470.
Pooja, it really helps to understand those figures clearly, because what we are trying to understand, like you also mentioned, that why should there be a decline? We are already, have poor numbers when we compare to the world, and then rather than improving those figures, from what you tell us, there's been a decline compared to the world averages when it comes to these important parameters in the health sector. Thanks, Pooja, for joining us. So what we are saying here essentially is that this latest report shows there's been a continuous decline in the health spending over the years. Is there a rationale behind this? What do we make of these figures, especially out-of-pocket expenses that cover most of healthcare expenses in India? And out of that, 30% is the government expenditure, 70% private expenditure, out-of-pocket expenditure on health that pushes lakhs of people below poverty line every year declined by 16 percentage points earlier, from 64.2% to 48.2%, but it is still not enough. Let me introduce our guest joining us this evening. I would first bring in Dr. Subhash Salunke, Senior Advisor, Public Health Foundation of India and National Member of the COVID-19 Task Force. Before I go to the other guests, let me first put a question to Dr. Salunke. Very good evening to you. What do you make of these figures? If you can help us understand that when we say the healthcare expenditure has declined, is there a larger story that is there behind this? Or are we really looking at a situation where the government's priority on healthcare has declined?
I would like to clearly indicate that these figures are not recent ones. They are slightly 1 year or 1.5 years earlier one. Due to COVID, definitely India has spent much more than what these figures are. However, one very glaring point, as you are repeatedly stressing, and that is out-of-pocket expenditure, which has definitely, even though from 63% it has come down to 48%, but even 48% out-of-pocket expenditure by lower middle class, by poor people, really pushes them into the poverty. That is a ground reality. And within the present budgetary allocations, or whether it is a part of the GDP percentage, you will have to also appreciate that India's spending on healthcare is primarily and basically as far as clinical part is concerned. That means it is related to the hospitals, it is related to creation of the AIMS, it is related to creation of the infrastructure, which is mainly focusing on a tertiary care. That's unfortunately not going to help us to the extent that we desire. Primary health care should be the goal of our country, and for that, the expenditure which is being spent for our part of the GDP on primary health care is really dismal. And unless Government of India and the state government try and focus on primary healthcare and partially to secondary healthcare and only focus on creating bigger hospitals, we are definitely not going to be as a healthy nation as we desire. That's what the reality is. So the GDP spending, percentage of GDP spending on health and healthcare, as far as health systems are concerned, is very, very minuscule. And compared to even neighboring countries, you go to a country like Thailand, you go to a country which is comparatively, much smaller than India, is doing extremely well. Go even to the extent of the development of health infrastructure and primary healthcare in Bangladesh, Sri Lanka. I don't think we can be very proud of what the present status of the healthcare is in India. But obviously, in last 2 years, finance ministers' speeches are indicative that Government of India is serious about it. They would like to, for example, last year, I think it was 86,000 crore rupees was being indicated for the healthcare. All these is still a very small percentage of what is really needed. And if you look at the graphs that you are saying, health expenditure per person is hardly $75, while Brazil, a country as economically, socially good, or whatever you can say, is spending so high. And that, let me clearly indicate, even though slightly blunter one, public health or health sector was never a priority of any governments in the past. Only COVID has shaken us. And now everybody, whether at the central government, whether at the state government, have realized the folly that we have not done investment in the healthcare, and that's why we are suffering. Now the COVID is on verge of going out, and I'm pretty certain the seriousness with which we were handling COVID pandemic, very competently we have handled it, that seriousness is going to go away or going to get dwindled unless really we sustain efforts. And if that happens...
So you are saying, Dr. Salunke, there were valuable lessons during the COVID period for us to learn. The fact that you need a robust health infrastructure for a country like ours with our kind of burgeoning population to survive an epidemic. Are you also saying that given the infrastructure we had, we managed to survive, but we cannot take these kind of chances again? Are there valuable lessons?
Definitely. We do not know whether, when and how the next pandemic or epidemic is likely to come. Look at the situation right now in India. Right now, H1N1, or people they use a misnomer or misleading term like swine flu. So swines have nothing to do with the H1N1 at this juncture. Now H1N1 incidence has gone up. People are dying. There are a lot of cases which are being reported in many states, including Maharashtra. Is that not a warning signal
Yes.
that it is not only a pandemic of COVID that we have to worry? It is all the possible outbreak-prone diseases, and most importantly, the NCDs, non-communicable diseases, which are posing as a very serious challenge and threat to the public health of this country. But I'm really sorry that in many states, still public health or the health sector is not a priority. That's very unfortunate for our country.
Yes, and these are government figures. So in a way, it's like showing the mirror to the government that this is how what your priorities look like. The government has aimed at taking the healthcare spending, Dr. Salunke, to 2.5% of GDP by 2025. But going by the rate it is going at this point, at this rate, how is it even going to meet that target? Is it simply just rhetoric? Like you said, no government has prioritized healthcare.
Absolutely. It is impossible for us to imagine by 2025 that we'll be spending 2.5% of GDP on the health sector. It doesn't appear to be. If it happens, a person like me who has spent 50 years in public health will be delighted and extremely happy. But the way things are happening in many states, even at the central level, I'm not very, very hopeful. I'm a little skeptical about it.
Which is why the emphasis on out-of-pocket expenditure, there the figures the government is saying has improved, the figures that show, that push people below poverty line because of the health expenditure, it has improved. But given where we were to begin with, that improvement is very small, isn't it? There are big strides that we have to make in it. So it's simply not enough to pat ourselves on the back, saying those figures have improved.
Even at this juncture, the schemes which have come out from Government of India, Ayushman Bharat Yojana, the medicines is not available in that scheme. And major expenditure, out-of-pocket expenditure, is towards the both medicines and laboratories investigations. And that is going to be, I mean, look at the poor fellow who, if at all he has to go to buy medicines and spend 100 and 150 rupees, and whose earning is per day is hardly 300 rupees. You can imagine. I know. I'm from a village. I have my own farm and I work with my population in my own village. The suffering that people have, even though we are suggesting that due to various interventions from Government of India with the newer schemes, have certainly helped the poor population. And that's where Government of India goes and saying
which means that when there is an intent, sir, when there is a political will, a lot can be done. COVID has shown us that also. Wherever there was intent, wherever you did the last mile coverage, it reached out to the last person, it did help. But then again, your attention turns away. Look at the politics of the country at the moment. We are fighting over places of worship. The focus is clearly not on the health sector. That is very unfortunate. Last word on what course correction you would recommend, Dr. Salunke, to get us to that figure that the government itself has set for itself on the percentage of GDP expenditure on healthcare.
As indicated in National Health Policy, if we could really reach within next 2 years, let us try and understand. COVID is an exceptional public health emergency related issues. We created so much of health infrastructure, but very temporary one. You know, what kind of interventions that were needed, definitely needed. But from the sustainable development and sustained development of health infrastructure, public health infrastructure, health capacity building, look at the HR situation. Look at the number of doctors, number of nurses, number of specialists available in the rural area, and look at the various states. Some of the states' situation is dismal. They don't like it. I mean, somehow in our country, if you speak truth, people don't like it too. But the fact remains, some of the infrastructural facilities in many states are far below the expectation. So if every state government, with the assistance and support and guidance from Government of India, clearly plan in next 5 years, we will certainly reach in health system side, in HR side, and developing the interrelated, interconnected kind of a system by which we will focus on primary healthcare, secondary healthcare. Certainly, nobody is going to indicate that tertiary needs to be neglected. So connecting all these primary, secondary, and tertiary, because right now in many states, a lot of politicians start feeling the You start a district hospital with the super specialty hospital, with the AIMS hospital. I mean, they are needed. Who says they are not needed? But look at primary health care.
This is
Focus
very
on primary
important,
healthcare.
Dr. Salunke. You are
50% money
saying
must be
that
spent on primary health
we
care.
are missing the woods for the trees. We are making big promises. Much of it becomes propaganda and posturing. When it comes to the real issues that need to be addressed, the ground reality somewhere, the government needs to wake up more to the reality, is what Dr. Salunke is telling us.
Everyone wants
The
to have
course
a medical
correction.
college and a bigger
Yes.
hospital. Yeah.
Absolutely. Those are important points, Dr. Salunke. Appreciate your joining us here on the program and giving us those perspectives. Thank you very much.
Well, thank you very much.
Let me now introduce Dr. Ishwar Gilada, Secretary General from Organized Medicine Academic Guild. Also, Dr. Sanjeev Bagai, Chairperson of NEFRON, joining us here on the program. Good evening, gentlemen. So first things first, let's just get opening remarks on the news that we are sharing with our viewers today on government spending on healthcare that has dropped to 1.28% to 1.35, from 1.35 to 1.28%. It might look very small, the drop, but the fact is that this is significant. The fact that there is a decline from previous years. What does it signal, Dr. Gilada?
See, basically, look at our country. Our initial priority was roti kapda makan. Thereafter, bijli sadak pani. Thereafter, we are now turning to education and health. So it's not that we have not made a progress. If we look at how many doctors were there when India got independence, only 50,000. Today we have 17 lakh doctors and 12.5 lakh MBBS and 4.5 lakh postgraduate. I'm not even counting other patches. You look at the average lifespan, 32 years, it has become 70 years. We made a progress. But what has happened initially, 10 years before that period, the health ministry or health department was reserved for some minority community people or from a party like PMK from Tamil Nadu. And we were never given importance to health ministry, health secretary. So it was like a parking lot. People who were to be punished, they were given health secretary's post. Now today the things have changed. And COVID has changed it further. It is not COVID only, but before COVID also we changed a great deal. So there has been change. The current budget shows 2.1% outlay. Yes, if you look at internationally, 89,000 versus 4,500. So, but the cost of medication in India is low. Cost of investigation is low. Cost which is a patient paying to a doctor is low as compared to internationally. However, there is a great scope. And no nation can be a wealthy nation without being a healthy nation. So if India is trying to be part of G7, G8 countries, India need to be a healthy country. And which we have shown that in COVID we could manage properly. We need to only sustain that kind of pace and speed. Secondly, out of whatever money we spend on health, majority of that goes on family welfare or family planning program. So hardly 50% remains for actual healthcare. And in that we need to look after a lot of staff. So a lot of thing goes for infrastructure and staff. It hardly goes for any medicine. So I think because of only private sector, we could survive to a great extent. However, some national programs are 80% government, 20% private, but generally it's 30-70 or 40-60. So a lot of infrastructure has to be maintained and built up. And I think now Government of India realized that health importance has come. Health minister or secretary's post are quite stable. Earlier, they used to health secretary used to change more often than the seasons in the country. So things have changed. I'm not
that's what Dr. Salunke was also saying. COVID has shaken us up. COVID has made us realize that this is not a sector that you can just take for granted. It doesn't run itself. The government must intervene where it is necessary. Dr. Bagai, your thoughts? Like we just heard, Dr. Gilada saying, only a healthy nation can end up being a wealthy nation. But often I think, the focus is not there in that sector to that extent as much as we see in the other economic aspects.
Good evening, everyone. Thank you for having me. And first to the first speaker and then to the second speaker, the situation is not that grim. I partly agree with Dr. Ishwar, but largely disagree with the first speaker. So let me put certain things in the correct perspective. The devil lies in the detail. When you're looking at a percentage, you have a numerator and you have a denominator. If your annual GDP now in 2021 going on to 22 is increasing as a percentage change for the first time in the last 6 years to positive 15.4 versus -1, -0.3, -2.7. The percentage may actually give you a false impression, but the true spend on healthcare is still increasing. And the reason I'm saying this is that last year and year before last, especially last year, we have spent more than 39,000 crores on the vaccine campaign, which India has probably done as the largest and the safest vaccine campaign globally. We don't need that kind of outlay for COVID vaccines, perhaps in 2022-23, because we've reached 215 crore vaccines as we speak today. The second important point is when you're looking at a GDP as a denominator now reaching 3.535 trillion USD, which is increasing. Yes, we need more amount of primary healthcare, more amount of preventive healthcare, personal healthcare, yes. But we have already allocation for 5 lakh primary healthcare centers to be converted into wellness clinics. That work on ground has actually started. We have done the vaccine campaign brilliantly well. We have an insurance cover.
Which is why, Dr. Bagai, we are looking at the overall picture of the total spending and the priority and emphasis on the health sector vis-a-vis the world at large, which is why we are making the comparison like that. But if you're only wanting to look at figures, how India has progressed, yes, I do agree with you that certain markers are positive, but we are looking at vis-a-vis the world. Are we giving enough emphasis? Are we spending enough on the health sector compared to other countries? And I ran those figures on our screens to show that we are way below in that list on countries that spend on health sector.
That is true, but we must appreciate one important point that in the last 5 to 6 years, we have a 40 to 45% increase in the total number of medical seats. We have a 30% increase in the total number of bed strength pan-India. We have already a 20% increase of doctors who are graduating, which are coming into practice in India. So I think there is progress.
Okay.
Please appreciate, and everyone must appreciate that we have a population which is 25 times more than the population of most other Western countries and at least 6 times more than the population of US. So it's an unequal comparison if you compare number of beds, number of doctors, which is 0.7 and 0.8 per 1,000 population in India.
No, we are making progress, Dr. Bagai. Don't get me wrong. We are making small progress, but the rate of the progress is not commensurate to meet the government's own targets. The government has aimed at taking the healthcare spending to 2.5% of the GDP, which is why we are questioning that at this rate, how will you make it to that figure at 2025? How does the government expect to achieve this if the spending is reducing, even though marginally?
I agree with that point. We need more amount of spend ongoing in the next 2 to 3 years, but much will depend upon the next 6 months, how we come out of this post-COVID. The vaccine campaign is not still over. COVID is still not over. We still have to look after the long COVID patients, which will go into millions. And like the 2 important points, the real focus of having more spend per individual is control population and control pollution.
Okay, that's an important point. Yes, I do agree that one would always turn around and say that given the figures when it comes to our population, Dr. Ishwar Gilada, the challenge is much bigger for a country like ours, and therefore it might sometimes be an unfair comparison to pull out the other countries and put out those figures because our circumstances, our set of circumstances are very different.
Yeah, basically, if you look at about 35 years back, the government budget was 0.3% of GDP for health. It is 2.1% now, 7 times jump. So in real quantum, it has jumped fantastically. But in even percentage also, it jumped very well. So basically, we are making a progress. As I told you, roti kapda makan is a priority. A lot of people still are hand to mouth. When somebody used to die in an accident, government used to provide 5,000 rupees ex gratia. Now that has gone to 1 lakh. So we are making a progress. But we need to sustain that progress, and the government should have that kind of forward-looking strategy, global health security at the heart, and infrastructure has to be equivocal, not only in urban area, but it has to be also in rural area. So our dismay problem is in rural area. A lot of doctors are concentrated in urban area. So we need to provide better facilities for doctors, healthcare staff, Anganwadi workers, so that they will be interested in rural healthcare. Otherwise, people would be always interested to jump to the urban areas. So we need to look at differently, but I think that focus is there. And we will continue to pressurize the government so that the health budget will continue to remain more than 2%. It should go to up to 2.5%.
Because the concern is, sir, that the poorest sections get affected the most, who cannot afford private health care. The moment you reduce government spending, it directly impacts the poorest of the lot. And like you said, therefore, the primary health care is the basis, is the backbone when it comes to these parameters. The government spending on health schemes contributed 9.6% of the total health expenditure in 2018-2019 as against 9% the previous year. That kind of minuscule rise we are willing to accept. What the problem, again, I reiterate, is that other figures, if you look at only, say, 41% of people in our country have a health insurance or are covered under health scheme. Yes, Dr. Bagay.
What happens is basically,
go ahead,
if healthcare budget is not spent properly earlier, then they reduce the budget this year. So I think they should look at proper spending, whatever is allocated. You don't try to save money. And there should not be a 31st March syndrome that you want to spend only during the year end. So that is a wrong strategy.
Okay, yes. Okay, closing comments, Dr. Bagay?
Yeah, I would be eternally optimistic. I think Indian healthcare has withstand and withstood many, many storms like the one in COVID and outperformed and outbeat almost all other countries in terms of mortality and morbidity figures, even though with limited resources. My carry-home message is we've done well. Yes, we need to do more. We need to focus more on primary and preventive healthcare. The percentage spent on healthcare, which is increasing annually, will increase perhaps from next year onwards even more, gauging by the situation of the hour as it exists. And I think the Indians as citizens have now realized post-COVID, or almost post-COVID, should I say, that the health of a person is in our own hand. Health is, I've always said, never a state subject or a national subject. It's an individual subject. We need to look after ourselves, become more preventive. We have not to only look at life and lifestyle, we need to look after our own health as life first.
Yes, that's again a very good way to end the program, that somewhere all of us have an individual responsibility in this. And I'll borrow the words of Dr. Gilada that only a healthy nation can be, after all, a wealthy nation. Thank you, gentlemen, for joining us on the program.